Guide to the graphic. Here we have a presentation of the rupture of an arterial wall. In purple is the arterial wall and resulting massive blood loss. Shock. Shock refers to conditions manifested by hemodynamic alterations, for example, hypotension, tachycardia, low cardiac output, and oliguria, caused by intravascular volume deficit, hypovolemic shock, myocardial pump failure, cardiogenic shock, or peripheral vasodilation, septic, anaphylactic, or neurogenic shock. The underlying problem in these situations is inadequate tissue perfusion resulting from circulatory failure. Pathophysiology. Shock results in failure of the circulatory system to deliver sufficient oxygen to body tissues despite normal or reduced oxygen consumption. General pathophysiologic mechanisms of different forms of shock are similar, except for initiating events. Hypovolemic shock is characterized by acute intravascular volume deficiency owing to external losses or internal redistribution of extracellular water. This type of shock can be precipitated by hemorrhage, burns, trauma, intestinal obstruction, and dehydration from considerable insensible fluid loss, over-aggressive loop-diuretic administration, and severe vomiting or diarrhea. Relative hypovolemia leading to hypovolemic shock occurs during significant vasodilation, which accompanies anaphylaxis, sepsis, and neurogenic shock. Regardless of the etiology, fall in blood pressure is compensated by an increase in sympathetic outflow, activation of the renin-angiotensin system, and other humoral factors that stimulate peripheral vasoconstriction. Compensatory vasoconstriction redistributes blood away from extremities and kidneys toward vital organs, for example, the heart and the brain, in an attempt to maintain oxygenation, nutrition, and organ function. Severe metabolic lactic acidosis often develops secondary to tissue ischemia and causes localized vasodilation, which further exacerbates the impaired cardiovascular state. And that is shock. Have a great day.